So, as promised, I'm going to upload the recordings of these PowerPoints that you got to miss on the first day of class. I really hate that the first day of class is getting started this way, but we will persevere and we will work through it and we will be okay. I always like to start out with some sort of inspiration or just kind of a quote to get us started. So, as you see, this quote talks about obstacles ahead and impossible situations and being faced with great opportunities that are often disguised as impossible situations. I know the beginning of this semester is probably disguised as an impossible situation, but it is a great opportunity, and you are getting to start into a great field and just a very rewarding profession. So, we're going to get started and talk a little bit about the nursing past and the present. It's important as you get started into fundamentals and introduction into nursing to really get a grasp of where nursing came from and what transpired throughout history to kind of get us where we are today. So, some of our learning objectives, these are some major things that you should be able to pull out from the PowerPoint and big things that you really need to grasp from the PowerPoint. So, why specifically is the profession of nursing so unique? I personally think it is so unique because we are one of the most trusted professions. People trust us with caring for their loved ones. People trust us with just taking care of them and giving them guidance, and people will hand you over their newborn baby to take care of. And in the same aspect of that, they will trust their loved ones to be with you for their last breaths. So we are one of the most trusted healthcare professions. We are also one of the largest healthcare professions. Nurses can work a little bit of everywhere, and so we are very widespread. And surprisingly enough, even though we are so widespread and we do have an abundance of nurses, there's still a shortage. So we are very unique. So some of the areas that nurses can work in, as you all have chosen to go to nursing school, you have a variety of opportunities. Nurses can work anywhere from school systems and, work in kindergarten through 12th grade and work with students and help to take care of them while they're in their school hours. They can work in home care, maybe managing wound care, chronic diseases, can work in nursing homes, hospitals, workplace nurses like occupational nurses, where nurses can work in the military. There's just so many different avenues. If you ever go into nursing and you pick a field and you get tired with that, you get burnt out, maybe you decide, oh, this is really not what I want to do anymore, you can choose something else. There's just so many different options. So when we think about nursing and how nursing is defined, hopefully when you think about nursing, some of these words come to your mind. Caring, compassionate, helpful. A lot of times when people choose to go into nursing, they want to help people. So some of those things should kind of come to your mind. Maybe you have some other words that you think of when you think about nursing. But as far as the ANA and the definition of nursing, they say that nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering, through the diagnosis and treatment of human response and advocacy in the care of individuals, families, groups, communities, and populations. And that's important just to note that we do care for individuals. We also care for their families. We do care for our communities and different diverse populations. So when we think about nursing, there may be several different images that come to mind whenever you think of a nurse. Definitely media and television, and there's been a lot of influences on that and what people think of whenever they think of nursing. Especially in the past few years, I feel like nursing has probably gotten more negative impact, but we want to change that and make it back more positive. But some of the images that you may see or you may think of, this one is Florence Nightingale, and we're going to talk more about her, but she is nicknamed the Lady with the Lamp. And the reason for that is because during the war, she did walk around and help take care of the soldiers, and she used her lamp to help guide her and light the way for her to be able to see to take care of them. Nursing can also be influenced by television and TV shows, whether it be something like Call the Midwife or it could be something like Scrubs. A lot of times nursing doesn't get the best image because of some of these television shows. Some other historical images of nursing, you may see the Angel of Mercy there on the left, and it was kind of more of a image like a messenger or a helper from God. Nursing was viewed as a person who works for God. They were competent and they had religious roots in nursing. And then the image on the right is another historical image you may see that a lot of times comes from television, the battle axe or cruel torturer. That's more of a negative aspect or negative historical image that nursing has gotten. Some other images of nursing. Nurses are viewed as a professional. They're educated, they're well put together, they're viewed as being listened to. When you think about nursing and what all we do, you oftentimes think of, oh, they're probably around giving medications or they're going room to room, maybe checking vital signs. You don't think about all the other things that they do. We document on our patients. We advocate for our patients. We're that lifeline between our patients and the doctor and trying to coordinate their care. Your other image on the right, this was a needed poster for nurses for the Army Nurse Corps, kind of a recruitment poster that is also a image of nursing. Military has also made an image because of nursing. The military image is more self-sacrificing. Nursing actually came around because of the war and the military and how Florence Nightingale helped take care of the soldiers. These are also some images that you may see of nursing. The one on the left, nurse as a handmaiden. She was there, had a limited role. She was more of like a writer for the doctor to help the male doctor. Nurses were typically viewed as female. Same as today, a lot of times people think about nurses being female, but that's not necessarily the case. There's actually more males getting involved in the career, and there's definitely room for them. But this picture specifically, the picture kind of depicts the handmaiden as a limited role. She's kind of scribing for the doctor, more of like a help to the doctor. Also, you may see that there are some negative images as well, that a lot of times nursing gets a sexualized image and kind of a negative image, such as like kind of we talked about television and Grey's Anatomy and Scrubs and those types of television shows. The nurses are kind of viewed as irrelevant, whereas they should not be. Nurses are a very trusted, educated profession. So nursing, when we talk about the past in nursing, nurses were self-proclaimed before the Civil War, so they had no medical training. They had more of a duty to care for their family and the community. So that has changed throughout the years. Nursing actually moved the woman from a home role and the woman being taking care of the home into more active roles where they were helping to take care of others. Some nursing uses that we talk about. We don't just do things. So this talks about knowledge in the nursing process. We don't just do things just to be doing them. So as we talk about Florence Nightingale, She worked during the war, and she started to see that a lot of the men that were coming in that were wounded from the war, they were dirty and wounded. And as she started to improve hygiene practices, then they started to get better. And so she saw that evidence started to change, and it made her realize that, oh, we need to be doing this because I'm seeing this start to trend and I'm seeing this start to improve. So in nursing, we use what's called evidence-based practice. We don't just decide, oh, we're going to do this today. There has to be research and reasoning behind what we are doing. So delivery of care, and the nurse's delivery of care, we want our care to be client-centered, and that's just really focusing on the patient that we are taking care of, and being goal-directed. We're caring for them in keeping goals in mind. You're going to hear a lot about goals this semester, and you should have goals, but keeping the goals in mind as far as why we are doing this for the patients. So client-centered care, we look at the patient as a more holistic approach. We look at caring for them and their entire body. We respect their values, we respect their preferences and their needs. So we start planning in our care to make sure that we're asking the patient their preferences. And if we can care for them based on those preferences, we try our best to do that. We educate the client as best we can around them being the center. We really try to educate them on their level and include them in all of our education. Health promotion and illness prevention, that's also important in client-centered care. Research and clinical expertise, processes for safety and keeping our patients safe, and then the use of technology. As far as being goal-directed, we do have goals between the patient and the nurse, and we really want those to be kind of on the same page, because the patient's going to be more willing to work with you if you are working alongside of them and keeping their preferences in mind when building your goals. Our interventions should also be goal-directed, so the things we are doing for our patients and the things we're carrying out throughout our nursing shift. We focus on team care and using everybody in the healthcare team to help take the best possible care of them that we can. Evidence-based care, like I mentioned a minute ago about evidence-based practice and using research to help guide our practice. Use of tools, avoiding errors, and then looking at data to help direct care and improvements. So what's unique about nursing? The ANA's definition, it includes individualized care. We are a care coordinator. We're caring. We utilize the nursing process that we're going to talk more about later on. ADPI is a really good acronym that you're going to remember, and it's going to be ingrained in your brain. So we assess, diagnose, plan, implement, and evaluate. And then we have a professional environment and provide quality care. So as far as our nursing history, this is just a brief timeline about the history of nursing. In 1873, we had the first professionally trained nurse. So that's a good while ago that nursing has been around. 1919, we had the first Nurse Practice Act that established the first registry for nurses. Around 53 to 56, Florence Nightingale was working at the Crimean War with 38 other volunteer nurses. 1959, CPR was introduced. 1964, the Nurse Training Act was implemented. And then 1965, we had Medicare and Medicaid that provides care for elderly and poor to help with their insurance cost and cost of their health care. So some change in nursing and how change was implemented into nursing. We have Florence Nightingale, who I mentioned was called the Lady with the Lamp. She was actually a statistician. She kept notes and statistics about what she was doing, and saw improvement with what she was doing. She cared for the wounded soldiers during the Crimean War. And like I mentioned, she saw them coming in. People were dying more so from the disease that they were getting while they were there, more so than the battle wounds that they were receiving. So they were coming in with a battle wound, but because they were staying there in these conditions, they were getting sick and dying from the disease itself. So she started putting some interventions in place and some hygiene practices, infection control practices. Started changing their sheets frequently. Started implementing cleaning procedures, and she really saw that by changing those sanitary conditions, she reduced the death rate from 42% to 2% just with hygiene practices. She also started the Nightingale School for Nurses in 1860, which was important as well. She has the first nursing instruction manual that she was put out, and really, documented notes on nursing. So this video, I'm not going to play it during your recording, but when you pull up your PowerPoint, I would encourage you to just watch it. It's a short video that talks about Florence Nightingale and kind of her historical implications in nursing and why she is so important to the nursing field. So just to kind of wrap up on her, her greatest contributions really were her hygiene practices. Yes, she did do a lot for the education of nurses and really putting together notes for nurses and using her Nightingale principles to help educate and change healthcare practices. But it was really those hygiene practices that were her major contribution. And of course, she also did the collection of data to help inform the process and create evidence-based nursing. So just a question, I'll always add in questions throughout your PowerPoints to try to, help you get used to hearing questions about the material that we're going over. So here's a question about nursing past. So which is the most influential factor that has shaped the nursing profession? So after we've just talked about Florence Nightingale and her contribution to nursing, it is going to be the military demand for nurses in the field. So another influential nurse that is important to mention is Dorothea Dix. She's really important if you are interested in mental health at all, but she was really important in treating the mentally ill in America. And she also established asylums. Another important nurse that we're going to mention is Linda Richards. She was the first professionally trained U.S. nurse, and she created a system of individualized patient hospital records. And she also, worked with creating dental records so that, now we have a record of this patient coming in. Each time they come in, we can add to this record, and it really was instrumental in how we think about documentation now and keeping a patient's medical record. Florence Wald, she was important in opening the first hospice house, or the first hospice in the 1970s. If any of you all are interested in hospice, some of these influential nurses are going to be important and can be some of your topics that you can choose for your poster presentation. So if any of these, intrigue your interest, then you might want to go grab them and sign yourself up for your poster to do them. But definitely they would be good ones to do. An interesting fact about her is she did open the first hospice, and she also died in hospice. So whenever she was in the dying process, she was involved in hospice. She's also called Mother of the American Hospice Movement. Virginia Lynch, she is important in starting the forensic nursing in 1986. If you are interested in forensic nursing and, criminology and go in that route, there is a certification that you can get, and you can get trained to be a SANE nurse, and that's a sexual assault nurse examiner. And it's someone who comes in after maybe a patient has been raped, and they come in and examine them, and they come in and look at different things to collect evidence, and they're specifically trained for that, to be able to handle those patients and talk to them very sensitively, and know exactly how to communicate with them. So she was instrumental in developing forensic nursing. Clara Barton. So Clara Barton was important. She actually did not attend nursing school per se. She had a nickname as well, and was called the Angel of the Battlefield and the Florence Nightingale of America. She's a Civil War nurse, a teacher, and a patent clerk. If you are in the military or ROTC, you may have heard of her before. She got permission from Abraham Lincoln to help find missing soldiers after the war, and she also founded the American Red Cross. The American Red Cross is still very instrumental today. They provide CPR certifications, first aid training. They come out and help people after disaster situations. It's just very, very instrumental. Mary Breckinridge, she was instrumental in, nurse midwife and labor and delivery. This actually was from Kentucky and was the founder of Frontier Nursing University. So as you go through the nursing program here at Carson Newman, there are some of your faculty that attended Frontier Nursing University. But she rode around on horseback, and she carried a little bag with her, and she would go and help to deliver the babies. And then, if she had to take them to be looked at, she would kind of carry them in her little bag on the horse. So a lot of times people would per se think that she delivered the babies to the parents, kind of like the stork in a way. But that picture at the top just kind of shows how the baby was in her little satchel. And then as we move towards today and influential nurses in modern times, we have Nurse Blake. I'm not sure if any of you all have ever heard of Nurse Blake, but he is instrumental in nursing today. He goes on tour and posts funny videos, and has some educational things out there. But you just never know that what could be you someday. You may develop a wonderful intervention that you may be famous for one day. You may do something or realize that something we've been doing all these years is wrong. And we may be talking about you later on. So just remember that you can be influential, and you can develop an influential career. So as far as education of nursing and different educational routes, so route to becoming a nurse, all of you all are in the section down here, the BSN program, Bachelor of Science in Nursing. This is a little diagram that talks about the average length of time for different nursing degrees. So there's several different types of programs that you can go through or take to become a registered nurse. There are diploma programs that last roughly 2 to 3 years. There's an associate degree program that lasts about 2 years. Yours is roughly 4 years if you think about all of your prerequisites and everything added in. And then the Master of Science in Nursing, or the MSN, is about 5 to 6 years. And that counts for you achieving your BSN degree first. So that's why it's a little bit longer. This diagram also shows a little bit better idea about the ladder or the tiers of a registered nurse. So down here at the bottom, we have an LPN, or a licensed practical nurse. They're a little bit different, and they go through a little bit different of a program. A licensed practical nurse doesn't take the NCLEX like you all are going to be taking. They do take a state board test, but it is not the NCLEX. Their training is completely different. So everything in this pyramid is ideally registered nurse. So in order to become a registered nurse, you can go any of these routes up through here. So you have the diploma program that typically lasts about 2 to 3 years. These are very rare now. They do exist, but they are rare and being phased out. You have a lot more clinical hours, a lot more hands-on training that happens in the hospital. And it was very common. A lot of your older nurses may have went to a diploma program. A lot of the hospitals around us in the Knoxville area had diploma degree programs there. So your next step up here is the ADN. That's your associate's degree in nursing. Typically, this one is like your Walter State, Pellissippi State. They're your community colleges that offer your ADN, or your associate's degree. It's typically about a 2-year degree. Out of all of these, your BSN, your ADN, and your diploma, they all achieve a registered nursing degree. They all take the same NCLEX exam whenever they graduate. They just have a different type of degree that may be a little more in depth or a little bit more hands-on. It's just a different way that they are trained. Your BSN, Bachelor of Science in Nursing, which is what you all are, takes about 4 years to complete. And it is, you can achieve the BSN if you have achieved the ADN first. So it's kind of like a ladder. So all of these three, once you graduate, you're going to take that registered nurse exam. If you decide you're going to go on to school after these, you've become a registered nurse and you're going to go on to school because you really want to advance your schooling. If you go on, you don't ever have to take that NCLEX exam again. There might be other exams you might have to take, like if you specialize in something, but you won't take the NCLEX again because you're already a registered nurse. So if you go on to school, you have options of going for your MSN, which is the master's degree, and it's typically about 1.5 to 2 years on top of your registered nursing degree. You can specialize in different areas. Like for mine is specialized in nursing education. Some people are specialized in nurse practitioner or family nurse practitioner. If you've heard of a CRNA, the nurse anesthetist, they are a master's degree. They're really pushing for a doctorate, but you can still find them in a master's degree. And then at the top, we have the doctorate. And that's about 3 to 6 years on top of your registered nurse. And you can be you can have your doctor of nursing, doctor of nursing science, or doctor of nursing philosophy. So a lot of your professors are going to have their doctorate as well. So just to kind of get an idea of, what schooling they had, what you may be looking into after you get out of school. So as far as nurse regulation and who regulates nursing, each state develops the Nurse Practice Act. And that's just kind of like a set of rules that nurses are to abide by. So they define a nurse and they set exam requirements. They set requirements on qualifications